Over the next 10 years, the world will see profound demographic changes. We expect the global population to increase by 1 billion people, with 500 million more people over 50 years of age. Think about that for a minute. Think about what it means for health systems, for societies. Chronic diseases already account for 70% of all illnesses, and as the population ages, that is set to increase. We'll have a larger, older population with growing healthcare needs. Unless health systems adapt to these demographic changes, healthcare spending is forecast to double. These socio-demographic challenges put a growing burden on our healthcare systems, which have responded with an increasing focus on managing costs, limiting treatment options for physicians and their patients. My vision for the EFPIA presidency is to shift the efforts of healthcare systems from narrowly focusing on decreasing cost to maximizing value. That is, getting the best outcome for patients and all stakeholders from what we spend. I believe this shift has already started, but it needs to be continued and it needs to accelerate. I believe a focus on outcomes can address many of our current healthcare challenges. Today, most systems do not know if they're improving outcomes or what outcomes they're achieving with their spending. Where data exists, we see huge variations in outcomes within and across European countries, and these variations are not correlated with the country's spending on healthcare. Systems are struggling to spend their money where it has the highest impact. A focus on outcomes can help these systems allocate spending where it really makes a difference. By focusing on interventions that really work and moving away from those that don't, we can improve health and make health systems more financially sustainable. We can improve the quality of care, sparing patients unnecessary operations, side effects, or avoidable complications. By focusing on what really impacts people's health, we can dramatically improve the efficiency of our health systems and improve patients' quality of life. That's why I'm so passionate about an outcomes-based approach. Data is essential to achieving better health outcomes and better value in healthcare. It can help us improve treatments, provide choices, and incent the right behaviors. First, imagine if we could accurately track the outcomes of patients and the treatments they received. This would let us identify variations in outcomes for similar patients and determine the root causes. The variation could be genetic. They could have tumors with different mutations. In that case, we can provide more targeted therapies. It might be that the patients have been given different treatments or treatments of different quality. In that case, we can identify and share best practice. Or it may be due to differences in lifestyle, such as diet and exercise, which we could work with patients to improve. Healthcare data can help us get the right treatment to the right patient, stopping ineffective interventions and reducing the risk of costly complications while protecting patient privacy. Second, data can improve choice. Patients often are not aware that they can have vast differences in outcomes for different treatments, different hospitals, or even different physicians because this information is not available to them. Informed choice will help patients get better care. Finally, good data on measurable outcomes can allow us to align payment and incentives. By looking at aggregate health outcomes as the measure of performance, we can hold different payers in the health system, including pharmaceutical companies, accountable for the real impact that they have on people's lives. We need to make sure that all stakeholders in the system get rewarded for working to improve health instead of filling beds or selling pills or doing a lot of diagnostic tests. There is already a lot of data out there in clinical records, in registries, in claims databases, and patients are generating a lot of data through health apps, wearables, and smart devices. Aggregated together, this data could teach us a lot about what works and what doesn't work. But we're not yet doing as much as we could to develop and gain insight from this aggregated data. That's why we've launched an important program within the Innovative Medicines Initiative called Big Data for Better Outcomes. Our aim is to identify, collect, connect, and analyze this data in a manner that is consistent with patients' rights to protect their personal data and use the insights to change the way that we deliver care. This is an exciting program that can transform the practice of healthcare delivery while contributing to the sustainability of European health systems. We look forward to collaborating with payers, regulators, and patient representatives. I believe that working together, we will harness the power of data to make a real difference for patients.